Hello, my name is Anna Adlam and I'm an Associate Professor at the University of Exeter. And today I'm going to talk to you about strategies to manage executive function difficulties for young people who've had encephalitis. And to do this, I'm going to show you some of the strategies that we use in our teen online problem solving intervention, so TOPS. So TOPS was developed by Professor Shari Wade in America, and over recent years we have been adapting and developing and evaluating TOPS in the UK. And so I wanted to talk to you a little bit about TOPS and what we've done to date, but also to show you the website so you can see how it works. And hopefully from that, you'll be able to see some strategies that you could use in everyday life too. So if you have any questions about TOPS or any of the work that I'm presenting today, then please feel free to email me after the talk. So my email address is here, a.r.adlam@exeter.ac.uk. And you can also follow us on Twitter and more recently on Instagram. So research is a team effort, and I just wanted to first thank all of the families and the young people who've taken part in our work to date and who've really helped us to develop this intervention and adapt it to meet their specific needs. Also to our collaborators, both in the UK and internationally, our research team members and the clinicians and charities that have supported this work to date. So what is TOPS? In TOPS, young people and their families learn a problem-solving strategy, which is A, B, C, D, E, and I'll go through each of these steps with you on the website as well. So A is where we identify the aim, B is we brainstorm some strategies that might be useful or might not, and then we evaluate those strategies and choose the best one or best few to try. And then we go ahead and create a step-by-step plan to implement those strategies, and then we evaluate whether or not they worked. So the way TOPS works is that the young person will work through the website material with a family member, so a parent or a caregiver. And we find that that can be really beneficial because then the family members know what the young person is doing, but also can support the young person to implement those strategies in their everyday life. And indeed, some of the families we've worked with have said that they themselves have found the problem-solving strategies to use when they've encountered problems in their everyday life too. Other strategies that are taught in the intervention of stress management, there's quite a big focus on stress management, as well as metacognitive strategies. So being able to stop and think and self-monitor and evaluate if what we're doing in that particular context is going to be most useful to us. So as I said, the intervention is delivered online. It's a website that we work through, and there's a trained therapist or coach that works with the family after each session. So they're usually delivered weekly or every 2 weeks. And the trained coach can then support the family and the young person to think about how that material that they've learned on the website can apply to them in their everyday life, and to start thinking about the problem-solving strategies that they can use for their own problems that they're experiencing. In this talk, I'm not going to go through the research because I really want to focus on just showing you the website and thinking about strategies that might be useful. But just so that you know, we have done a lot of research on this intervention. And in 2019, Professor Shari Wade and colleagues published a meta-analysis of the data that they had to date. So that was with 359 young people. And they found that TOPS reduced child behaviour difficulties, everyday executive functioning difficulties, so improving everyday executive functioning, and decreased parental distress and improved family functioning, both at immediate and at 12 months outcome. So as I said, I'm not going to talk through all of the research, but I just wanted to show you all of the work that we are doing at the moment with TOPS. So there are different versions of TOPS that have been compared, also been compared using randomized control trials to active controls. So this is where families worked with a website that had information and support around brain injury, but not specifically around problem solving. And TOPS was found to be more beneficial for everyday executive functioning than having just general information about brain injury. When comparing the different versions of TOPS, so there's the web-based version, which I'll show you today, which has the support of a therapist. There's a self-guided version where the young person and their family members just work through the website on their own. And there's a face-to-face version where the young person and family would come into the clinic and work with the therapist or the coach in the clinic using the website together. And on the recent studies that have looked at and compared those different versions, the web-based version with the coach seemed to be the one that the families preferred. And the feedback was that this was because using the website in your own time, booking in the flexibility of meeting the coach in your own time, seem to be better for families, but in terms of effectiveness, they all had the same level of effectiveness in terms of their outcomes. We have different versions of TOPS. So there's a version that's been developed for young people who've had a brain tumour. There's a version for young people with epilepsy. There's an Italian version where TOPS has been translated both by language as well as culture for use in Italy. There's a version for New Zealand where, again, cultural adaptations have been made for the intervention to be more useful for young people from the Maori culture. And there's the UK version too, which is the one I'm going to be talking about today. And we're working with Shari Wade to develop a transdiagnostic version, which is where we'd be looking at using this intervention for anyone who's having everyday executive function difficulties, independent of the cause of those difficulties, and also developing a version for younger children aged 9 to 12 years. So I'm now going to take us to the website and just to show you how it looks and also to work through some of the problem-solving exercises together. I'm just going to share the website on my screen. And hopefully you can see this. So this should take you to the home page. And here you can see that there are some tutorials for families and young people to watch just to orientate themselves to the website, to think about the sessions that they're going to be using and to work through the problem solving steps, but I will do that with you in just a moment. There's then the getting started. The keep going is the tab that we click to go back to where we left off, so to resume the work that we were doing. And there's a my progress tab where we can monitor the progress that we're making through the intervention. I'm just going to show you some of the content of the core sessions. So the way this version of the intervention is set up is that there are 10 core sessions. So they could be completed weekly, or for some families, they prefer to meet every 2 weeks and work through it at their own pace. It starts with a getting started session, which is just to orientate the young person and the family to the website and how the intervention will work. And working with the coach. There's a session on staying positive and handling stress, and this is building on from cognitive behavioural therapy strategies around how we work with any negative automatic thoughts that we might be having, and some reframing around those thoughts to try and think more in a problem-solving approach. There's the problem-solving module, which I'll talk you through. Getting organised, so that's the everyday executive function difficulties that can be experienced around organising materials and resources for school or college or home. There's the staying in control, which is the self-monitoring module, which again I will show you in a moment. And then in session 6, young people can choose between managing fears and worries or controlling and managing anger, depending on which one is most appropriate for them. Then there's the verbal and non-verbal communication, so the social communication strategies, including a session on social behaviour and problem solving. So this is how to join into groups, how to interact with peers. And then there's a module on taking care of you, so self-care around sleep, diet, exercise, and moving forward and planning for the future. I'm just going to quickly show you as well the supplementary sessions. So in this version of intervention, everyone would have the 10 core sessions, and then they can choose up to 4 sessions to work on with their coach. And the decision around which sessions to do as extra sessions can be done as a family and also with the coach's support. So just to give an idea of what these are, so there's one on decision making and making choices. There's one on coping with visible and invisible disability. So this links into the experience that some people describe around having a hidden disability. There's a module on managing medicine, of self-advocacy, working with school, communication between parents and their teenager, pain management. There's a module on family coping, specifically for parents, on sleep, memory strategies, life after school, so thinking about what comes after school and college, seizures, guilt, grief and caregiving, marital communication. There's a session for siblings as well, and a session on initiation, so they're kind of getting started and finding that motivation to start things. Okay, so I'm just going to show you, if I come back to the problem solving intervention, module, just so you can see what that looks like. So the way the sessions are set up is that there's a contents page, and I'll just take you through the first one so you can see how this looks. So there's some text on what is problem solving and why it's important and what the steps involve. And you can see a progress bar here. So as the person is working through this module, the progress bar will increase. So as you can see, I've done it. So we've moved up to 100%. But if this was new, it would start with 0 and we would gradually work through the module. It'll just take a little while to load up. So it goes through each of the elements of problem solving. So that's stopping and thinking before we go ahead and think about how to solve our problem. It's first noticing that we're in that situation and we need to just stop and think. Then it's about identifying the aim. And throughout the modules, there are animated videos that describe and explain some of the concepts that are being shared in the website. I won't go through all of those. I'll show you a video at the end which will summarize the problem solving steps. And then we have examples as well to work through. So here's an example of Connor and Sarah who think they have the same problem, but when they work through their problem, they realize that what they thought was the problem is actually not the same. So that's something that we think about too, is we think we've got a problem, and it's only when we work through the problem solving steps that we can identify what the real problem is and therefore what the best solution will be for us as individuals. And then the brainstorming step is described here again with an animated video. And then just take you to the next page. This is where we talk about how we choose the best strategy, again with a video to help support that. And then there's an exercise that the young person can work through with their family member to think about the different elements of the problem and the different solutions, and to evaluate which of those solutions might be best. So there's some practice examples in here too. And then moving into trying it out, so putting that plan into action. And then evaluating the results. So did it work? And if not, what would we do differently? And again, there's another exercise here on identifying what the aim is, how to brainstorm the different elements and strategies, and thinking about how to choose the strategy and then evaluating it. Sorry, click the wrong button there, just take us to this one. Okay, and I just want to play this video for you. So at the end of each of the modules, there's a video summarizing all of the content that has been shared.
You may be feeling stronger emotions than before you were diagnosed with your brain condition. This can make it easy to overreact, which might cause problems in your relationships with friends and family. When you start to feel like you might lose control, stop and think. Pause and take a breath, then decide what to do next. Stopping and thinking can give you the time to make a better choice. Sometimes problems can seem hard to fix. Luckily, there are 5 easy steps to problem solving. Running through them will have your problem solved in no time. First, aim. Decide how you want a situation to turn out, whether it's remembering to turn in your homework every day or falling asleep earlier every night. Second, brainstorm. Think of all the possible solutions to the problem and write them down. Write down everything, and for now, don't worry about whether the idea will work or not. Third, choose. Decide which of the ideas you came up with has the best chance of success. And then fourth, do it. Come up with a specific plan and try it out. Last, evaluate. Did it work? Do you need to try again? You can repeat these steps until you have a solution that works.
Okay. So I'm just going to take you now to the problem solving steps that I mentioned. And we'll just work through an example together. So at the end of the problem solving session, so session 3, the coach would then work through an example with the young person where they could think of an example problem and how they might go about identifying strategies to help overcome or manage that problem. And we'll work through that one together. And then what happens after each of the sessions that I've shown you is that the coach would then work with the young person again through this problem solving exercise to think about a problem that relates specifically to the content that has been covered in the module. So for example, where we talked about getting organised and the module on organisation, the coach would then work through with the young person and identify what specific areas of getting organised would be most useful for them and how they might identify strategies to overcome that. So we're just going to create a new plan. Yeah, sorry, it's being a bit slow loading up. So I was trying to think of an example that we might have for this exercise today. And one that came to mind was one that was actually shared with me, which was around feeding a pet rabbit. And this goal was quite important for the young person because for the family, it demonstrated a sign of independence. And for the young person to be able to feed their own pet rabbit would then enable the family to feel more confident that the young person would be able to show that independence and be able to do more for themselves and meet up with their friends and do all of the things that teenagers would enjoy doing. So we're going to use this one as an example for today. So my aim is to feed my pet rabbit each day. The young person was motivated by this because they wanted the family to stop nagging them to feed the rabbit. So then we get to brainstorm some ideas. So how might we solve this? How might the young person remember to feed their pet rabbit each day? So some examples might be have my mum remind me. Another solution could be setting an alarm. Setting an alarm on my phone. So it could be a diary entry each morning, which prompts feed the rabbit. Another example might be to write a note and maybe stick that on my bedroom door. Another solution might be to keep the rabbit food in the kitchen. So maybe the young person would then be prompted when seeing the rabbit food to feed the rabbit food in the morning when they make their own breakfast. And another option might be get the food ready the night before. So once all of those solutions have been discussed, any solution can be offered at this point. Then the young person can think about which of the solutions are going to be the best for them. So which one is likely to be the most useful for them. So have mum remind me, well, that may be helpful, but actually that could also be nagging for the child and young person. So that might be, yes, it could solve the problem. Maybe it might cause alternative issues. And will the family be able to do it? Yeah, mum might be able to do that too. So I'm going to say yes to that one. But I've put the maybe because although it may solve the remembering to feed the rabbit, it might cause other dynamics for the parent and their young person. Setting alarm on the phone, yes, that might solve the problem. And yes, the young person could do that. Writing a note and sticking it on my bedroom door. So again, we would ask, is that going to solve the problem? And would you be able to do it? So yes, it might solve the problem, but then once they've left their bedroom, they've come downstairs, they may get distracted and forget to do that. So maybe that's a maybe. Yes, they can do it. They could put that on their bedroom door. Keeping the rabbit food in the kitchen could help to prompt feeding the rabbit when they're making their own breakfast, and they'd be able to do it. And getting the food ready the night before, it might be helpful, but there is a risk that they may not then implement it the next morning. But yes, they would be able to do that. So then this shows us of all the solutions that we've presented and identified, what were they rated as to which one would be the most useful. And we can see then on the scores which ones we might want to try. So in this example, the ones that have got the highest rating in terms of how useful they're likely to be and how effective they're likely to be is to set an alarm on my phone and eat the rabbit food in the kitchen. Okay. And now the young person would then, with their family, think about what action they're going to do and when. So the first step in the action will be to set an alarm, a reminder on the phone, and then they can choose when they're going to do that. So they might want to do that today. And then the next step would be to move rabbit food to the kitchen. And they again could try that today. And then they may then want to decide whether to put in an additional step. So for example, if none of that works, what would be the alternative? And an alternative might be that mum writes a note if rabbit has not been fed. And that could start, let's say, tomorrow. Okay. And then at this point, the young person can decide whether they want to receive an email to remind them about their aim and how often they want to do that. And here we can see this. So here we have the aim, the best solution that we've identified, the steps that we're going to do. And then when reviewing this, the young person and their family and coach can then evaluate how useful these strategies were and whether they've achieved their progress or not, and if they wish to continue working on this aim. Okay. So I'm just going to very quickly show you a video of staying in control, so you can see the other element of this intervention. And I'm going to take you to the summary here, and we can just quickly watch a video of what the staying in control self-monitoring aspect of the intervention includes.
It's important to think about the choices you are making so they do not lead to problems. Most problem behaviors are habits, things that we do without thinking. Controlling your behavior requires conscious effort. In order to change a behavior, you need to watch or monitor yourself. Now it's time to get smart. Stop and think. This should be a familiar strategy by now. Monitor. Am I doing what I plan to do? Sometimes monitoring or keeping track is enough to change the behavior. Appraise. How are other people reacting? Use the cues that the people around you give you. Reflect. Is this likely to turn out the way I want it to? Think about what's happening and what is likely to happen next. Try a different behavior. If it didn't work out the way you wanted to, try something else and see how it works. Getting it right will take time and practice. That's okay. Your body may respond differently with a brain condition, and this is true for drugs and alcohol. Even a small amount of alcohol or drugs may have a big effect on someone who has a brain condition. They may have trouble walking or talking after only a drink or two. Knowing these things and learning to monitor your own behavior are ways to help you manage the symptoms of your brain condition and do what is best for you.
Okay. So hopefully that gives you a flavour of what the teen online problem solving involves and how it looks. And I'm just going to quickly share just the final few slides of my talk today. So I just wanted to let you know that the feedback that we've had from families has been very positive so far. So some of our families, this is examples from them. So one family said it was a very positive and useful experience, and I would certainly recommend it to other parents with children with brain injuries. Another family said it was good having that weekly session where me and my young person actually sat down and did something together, sat down together and did something. And another family said it would definitely be helpful for a wide variety of people, no matter how far along they are. And that's where we were asking about when would it be useful to have an intervention like this. So where next? We're now moving into the implementation phase in the UK, and we have some funding to start that work. So we're going to be training a few staff, a small number of staff in Exeter who can provide the intervention across the UK because it can be delivered using video conferencing such as this. We'll be evaluating our referral rates, the uptake, user satisfaction and clinical outcomes. And in terms of who can pay for the intervention, so we have funding now, we have a philanthropic donation to be able to offer this intervention to families. We can also take self-referrals, so private funding, as well as medical legal cases. And we're working with the NHS to set up some commissioned referrals, as well as charities and government funded disability student allowance too. As I said, if you'd like to find out more about this intervention, or if you'd like to ask me questions after today, then please just come back to me via email. And certainly if you'd like to be included in our implementation study, then just let me know. Thank you very much.